graduated from medical school in 1987, and I did my OB residency through 1991 and my high-risk fellowship through 1993. The first 5 years after my fellowship, I was in Asheville, North Carolina, working as full-time faculty for a community residency program. And then after that, I went into private practice in Atlanta, Georgia, and I was there for almost 20 years. And then an opportunity came up to actually just transfer to Melbourne, Florida. My husband and I are not really city people, and we were really thrilled with the opportunity to move to a smaller community.
Can you talk a little bit about how you got into medicine, if you were at all inspired by a woman to enter the field?
I started out as an undergraduate as a pharmacy major. There were lots of women in pharmacy school, but the pharmacy school was not supportive of my intention to continue to play varsity tennis at my university through school. And so I decided that perhaps I would change my major, and the chemistry department faculty was so supportive that they actually used to come to my matches and got really involved with my team. And there were very, very few women in an academic chemistry department in the early 1980s. But the guys were amazingly supportive and made me feel like I could do anything that I wanted to. And so then I decided to go to medical school. And I got to medical school, and back in that day, medical school was less than a third women. But I did meet someone that I loved, who was actually not a physician, but a PhD in anatomy. She had advertised for a very part-time administrative position, and I kind of needed the job, and I was interested. And she likewise made me feel like I could do whatever I wanted to, which was wonderful.
What do you think it means to be a woman in healthcare today?
I think it's an honor to be in healthcare in general, whether you're a man or a woman. It's a fantastic field, regardless of what position you hold. I think that it's great to be a woman in an OBGYN field because, well, we do have some similarities to the patients that we care for. Although I do joke with my patients that I've never been pregnant. I don't have any kids. Cared for lots of people that did.
What are some of the challenges of being a woman in healthcare?
I think it's gotten better over the decades that I've been doing this. There are still traditional women roles that we feel like we have to fill in terms of household chores and laundry and cooking. I never was saddled with the child care responsibilities that some of my colleagues were. I think that there were days when people weren't very well supported to have pregnancies. The guys weren't well supported to take off time when their wives had babies either, as far as that goes. I think things have gotten a lot better over the years in that respect, but probably just trying to be a professional and have the same home responsibilities that you grew up with. That is the biggest challenge.
What are some of the positives that come from being a woman?
I think that we are naturally detail-oriented. I think we multitask well. That's a necessity. I'm not sure that there's anything all that superior about women over men. I think everyone's different.
What advice do you have for women that may be applying to medical school or entering the field for the first time?
I'm jealous because you have every opportunity open to you now. When I was a medical student, the women were not allowed to enroll in the sports medicine elective because it was for guys only. We had very few role models in academic medicine. We had very few role models in any of the surgical specialties. I think when I was a medical student, there was one general surgery resident that was a female, and I don't think she was being treated very well. That has all changed. Now women can be orthopedic surgeons and urologists and whatever they want to be. And so I'm a little jealous because I think there are more opportunities. Well, I wouldn't trade what I do for the world, so that it wouldn't, I'm not, I don't resent it, but I'm jealous that there are other opportunities for women. There are challenges about being a physician in the current climate, but I wouldn't trade it for the world. And I would encourage anyone that wants to go to medical school to do it. And they have lots more role models. There are women who are chairmen of academic departments. There are women who are editors of leading journals. Lots more opportunities and lots more role models than there were 30 years ago.
How can women physicians best support fellow women physicians in the medical field?
Again, I think the times have changed and that's a lot better. But I think that We have to be aware of women physicians in our areas that have challenges at home, that have relationship issues at home, that have childcare issues at home. There are still inequities in terms of academic departments. I don't feel that at all because I've been out of academics for more than 20 years. But there are still inequities in academic departments and opportunities for advancement. And I think women are still sort of passed over because it's perceived that they may not want the positions of responsibility. But times are way better than they were.